Now is Democratic Congressman Jim McDermott. He is a member of the Budget and House Ways and Means Committees. And with a welcome to you, Representative McDermott, it's nice to see you again, sir. When we think about the major impact yesterday's cuts are going to have on families, many are pointing the blame at Republicans because of their stance on the entitlement programs. But do you think your party could have done more to avoid yesterday's cuts? Or is there a chance that the party didn't think it's going to be so bad once it materialized?
Well, I think there's always room to improve the programs that people have. Medicare, Social Security, food stamps, all these programs. But when you cut money out of a food stamp program, you're taking food right off the table. I stopped in the grocery store and bought $36 worth of groceries the other day just to see what it's like. And, you know, it was 5 yogurts and it was 5 cans of soup and a box of Triscuits and a few things. And you say to yourself, if that's what you're taking away from a family of 4, some days there's simply not going to be anything on the table for those people. So it isn't a question of whether they're living high on the hog. It is really a question of whether you're giving them enough energy to go to school and do well in schoolwork or to go look for a job or anything else. If you want people to work, you've got to have them fed.
Yeah. How do you see both sides of the aisle trying to negotiate on a farm bill, considering such a huge $35 billion gap between how much the House and Senate want to cut from the food stamp program?
Well, one of the questions that has to be answered here in the budget is whether or not we're going to have additional revenue. The Republicans keep insisting there can be no revenue. Now, if they do that, that means the SNAP program will be cut, but it also means health research will be cut and the sequester will continue, and it's going to be very hard to get a resolution of the budget problem if you're unwilling to close some loopholes and get some additional money. There simply are some things that we are now cutting, which are going to have long-term effects that we just, as a society, we cannot stop investing in, like food for kids and health research.
All right, I want to switch gears and address the Obamacare debate, sir, because I spoke with Republican Congressman Tom Cole just a few moments ago, who said that the president should have perhaps conceded to their demands for a delay in Obamacare, up to a year perhaps, and that could have avoided these glitches. What's your take on that?
No, I think he's wrong. Everybody, in fact, I predicted 6 months ago there'd be problems, because anytime you try as big a social program as this, where you're trying to bring 30 million people into a program that have never been involved in health insurance before, and many of whom don't understand computers you're going to have glitches. So you have to power through it. We did the same thing with Social Security. In 1935, you had 21 million people that did not have a Social Security number. We had to issue a Social Security number for everyone. We had to sort out all the Smiths and connect the Smiths to their income to do this Social Security program. It was very difficult to do. It was a mess at the beginning, but it's working just fine now.
Okay.
And I think this is going to work well.
I'm curious, though, as being a member of the House Ways and Means Committee, your chairman, Dave Camp, he wants to subpoena HHS and get the numbers of people who've enrolled now up to this date. Do you want to see the numbers?
You know, when we started the Part D, the drug program in Medicare, we didn't have an oversight hearing for 6 months. We waited and let it get started because the Democrats didn't come in and hammer them and try and make them look bad or anything else. What Camp is doing is trying to make the president look bad by asking in the first month is just barely over yesterday, and he's already saying, how giving me the numbers. Well, have a little patience. My mother used to say, you know, a little patience doesn't hurt anything, and that's really where we are. We're going to do fine in the end.
Do you think the problems with the rollout have given the Republican Party more leverage to be more aggressive?
Well, clearly, it didn't help anything to have the computer system be a big mess. I mean, even in the state of Washington, where we had done our own exchange, we had computer problems because we had 3 times as many people show up on the first day as we expected. So I think we underestimated the pent-up demand out there, and I really think that it would have worked better if it had worked smoothly at the beginning, but we're going to get through it. It's not the end of the earth if one day is a bad day.
Yeah, I do like your candor, though. It didn't help anything. That's true. Democrats are taking a hit, though, over the rollout, much like the Republicans took that PR hit over the government shutdown. Which one do you think is going to have a more lasting effect, though, for the midterm elections?
I think the decision by the Republicans to close the government down was a self-inflicted wound that they're going to have a hard time getting over, because people understood that they were willing to sacrifice anything to get the president. I think this problems with the Medicare or the health care bill is those will be forgotten by 6 months from now or a year when we get to election and people are having health insurance and getting their needs taken care of and getting preventive care, all these things that are going to happen. They're going to be grateful, I think, and you're going to have people in some states saying, why can't we have what they have in California and Oregon and Washington? Where's our governor? What's our legislature doing? You're going to see a lot of turmoil in this country over states that have refused to participate.
All right, Representative